Okay. Do you want me to read the case study?
Sure.
Okay. Susan's mother, Carol, is a 65-year-old with breast cancer. She is receiving hospice care in her home. Carol is currently receiving a long-acting opioid analgesic supplemented with a short-acting combination opioid and non-narcotic medication for breakthrough pain. Explain the difference between the mechanisms and treatment of acute and chronic pain.
I put for acute pain, you want to figure out what the underlying problem is, because if you can find the source of the pain, then you can correct it. Versus with chronic pain, you're just trying to manage the pain.
Yes, because that's on page 436, correct?
Mm-hmm. Sorry, my computer was trying to shut down everything and restart and do an update, so sorry about that. But I am back, I think. Are we still on the first?
Yes.
Okay. What I typed up back open here.
It says managing acute pain is done aggressively with usually pain medication before it becomes severe. So I guess that would be one treatment of acute pain.
Mm-hmm. Yeah, I wrote down some notes from one of the videos I watched, and I just kind of said that acute pain is more of a inflammatory response, and it serves as a protective function and usually responds to analgesics and anti-inflammatory agents, as chronic pain is the exact opposite. It can be difficult to treat and doesn't usually serve any kind of adaptive function or response. And again, finding the source for acute.
Okay. And you said it's difficult to treat because they don't know the underlying response for chronic pain, or what was that again? I'm sorry.
Oh, no, I just said it's difficult to treat. And I was agreeing with Violet's statement about finding underlying causes.
Oh, okay. Got it.
I think the problem with chronic pain is that any person becomes tolerant. So the medications don't work as well because you become tolerant of the pain medications. And so therefore you can't control the pain. So if in the acute phase you can find the underlying cause and correct it, then you don't have to go into the management phase of chronic, because you can't always treat the pain. It's something they have to manage and deal with.
I think also including for chronic pain would, I don't know, I guess it could be both, but I think I read or heard somewhere, trying to find it in here, that chronic pain is a lot of times linked to neuropathic pain issues, like nerve pain or compression or any of that kind of stuff. It's hard to find where I read that at.
Okay.
Are we ready for question number 2?
Yes. Sorry. Describe the actions of opioid drugs in the treatment of pain. So that is on page 441, I want to say, in our book.
In the notes, the PowerPoint notes, on slide number 19, it talks about the opioid is commonly used to relieve the sensation of pain, to create an absence of pain.
Okay. All right.
Do we need to, I don't know how far down we need to go. Do we need to talk about how
How they
they,
interact with the receptors.
yeah, that's
The three
exactly what I was trying to say.
Yeah.
I don't know.
It's been a long day. Because we could just say it interacts with the 3 opioid receptors.
Yeah,
I don't know that we need to like name them and describe what each receptor does, but that's specifically how the drug works.
I would just say that,
Okay.
like something like opioids mimic chemicals in your brain and body that attach to parts on nerve cells called opioid receptors, maybe, or just opioid receptors, something like that.
Yeah.
Would probably be fine, I would think. I don't know how deep and detailed we're supposed to get, but that I think would be okay.
So, like if I put opioid medications are characterized by their interaction with 3 types of opioid receptors, and then I don't know, state something about how that's how they help to reduce pain.
Yeah.
Yeah, I think that sounds good.
Is that all we're wanting to put on that one?
I would put something about that it decreases the sensation of pain, but you kind of already said that, so.
Okay. Yes, I put what you said earlier. I said commonly used to relieve the sensation of pain and create the absence of pain. Correct?
Yep.
Okay. Okay. All right. It says number 3 is define the term tolerance as it refers to the use of opioids for the treatment of pain.
The definition of intolerance that the book gives just says it's defined as a lesser response to a drug due to repeated drug administration. It's on page 435.
Thank you. Okay.
I also put, as your body becomes more tolerant of opioids, it takes more and higher doses to treat the same amount of pain.
Mm-hmm.
So as the patient's body
Becomes tolerant.
okay.
It takes more and higher doses of medication to treat the same level of pain.
Okay. All right. And so what else do we need to put on that one then? That along with tolerance, isn't it that if some people become tolerant to medications, they need to like change medications or take a break on that medication? I don't know.
But that is an option. That is a treatment option, is to change the medication if they become tolerant.
Yeah, because it's no longer working for them. So
I don't know where that is in the book.
I mean, I just came up with it in my head.
Well, I mean, you are right.
No,
That's
but
what
it's
we do.
correct. So,
I mean, I'm just winging it right now.
Yeah, no, you're good.
but yeah, you would either change it or increase the dose. The problem with you can only increase the dose so high, then you
Yeah.
can change it.
Until they start eating it like Skittles and then they come into the ER.
Right.
Yeah.
And then they come see me on a ventilator.
Yeah. And then you're like, hey, buddy, here's Narcan.
Right.
Hi.
Exactly.
Had a paraplegic come in yesterday, overdosed. I'm like,
Oh,
oh,
no.
he's paraplegic. I don't know that you know what that word means.
So you're
Oh,
like,
I'm sorry, they said he was a quadriplegic.
oh, a quad. Okay,
And I'm
so
like,
so you're like, so who administered this if he's a quad?
That's what we kept asking. We're like, is this suicide or homicide attempt? 'Cause
Did he just like
Exactly.
lick it up off a table?
right. He was not a quad. He was just a para. But
Oh, okay.
the outline facility does not know the difference. So
Oh,
Goodness.
perfect.
That's not good.
it's fun.
I mean, as long as they don't take the blood pressure around the neck on a quad, you're fine, right?
Right.
Okay.
Yeah.
Sorry,
Lord.
I'm getting off
I
subject.
think that's sufficient, though. She didn't
think
ask for anything in greater detail, so
Yeah.
I
mean,
think
she
that's
was
good.
asking us to define it, so.
And just state that once the patient becomes tolerant, to reassess the patient's pain and their medication reconciliation to further help that patient. I don't know.
Yeah.
But there's other options besides pain medicine.
Yeah.
There's physical therapy, there's range of motion.
Non-pharmacological.
Yeah.
So
And
I
that
would
would-
put that on there too.
So along with taking that medication per se, we could say that they could add non-pharmacological.
Yeah.
Yeah.
Pain management.
Okay.
Like a non-pharmacological pain management
Yeah.
strategies. I don't know.
Because there's physical therapy, there's distraction techniques, there's multiple different things you can do besides opioid pain medicine or any type of pain medicine for that matter.
Yes, but everybody likes those.
Yeah. Because they're Skittles. They're like Smarties. You just
They make me feel so good.
That's funny.
you just eat them.
I think there's a good portion that don't like it as well, but
There is,
No,
but you
they
never
just-
see those in the ER.
Don't come see me.
No, they say they're allergic to everything
Yes.
except for
I love
certain
that. I'm allergic
ones.
to Tylenol. And I'm like, I don't know that that's an actual thing.
Yeah.
that's funny.
Hmm.
So, anything else for the good of the order?
I think so.
Okay.